Hello, this is Dr. Grande. Welcome to my video on the theory of analytic therapy. Analytic therapy was developed by Carl Jung, and it has some similarities to psychoanalytic therapy, but it focuses less on the role of the unconscious mind and more on a client's desire and ability to accomplish self-realization. So first, let's take a look at the theory of personality in analytic therapy. And like Freud, Jung divided the mind into three areas. In Jung's case, it was the conscious, the personal unconscious, and the collective unconscious. The conscious mind contains material that someone is aware of in the moment. The process of organizing the conscious mind is referred to as the ego. The ego is the gatekeeper to consciousness. The personal unconscious contains thoughts, memories, ideas, and perceptions that are repressed or forgotten. And the personal unconscious stores both important and unimportant material. The unimportant material, the material that's not related to what's going on with the client and has no emotional consequences, is considered appropriately stored in the personal unconscious. But the important material, that's material that has emotional consequences, this material is referred to as a complex. And that brings us to the collective unconscious. And this concept is not really seen or used in other modalities. And it's different than the unconscious that Freud refers to in psychoanalytic therapy. So the collective unconscious, according to Jung, stores concepts that are independent of the conscious mind. These concepts are shared by all people, but they're not inherited. What's inherited is the predisposition for certain types of ideas, and these ideas are referred to as archetypes. So let's take a look at archetypes. Archetypes are universal thought forms. They don't have any content. It's just form. And you could think of them as a pattern of reactions. Archetypes are thought to bridge the collective unconscious and the conscious. Symbols do have content, and they are different than archetypes. Symbols are considered an expression of archetypes. There are many different kinds of archetypes, and I selected just 4 here to discuss. And these 4 probably are the most popular archetypes in analytic therapy. The first is the persona, or the mask. And these are personality characteristics that are made public, that are present to the world. One thing that's important to understand about the persona is that it can change from moment to moment. For example, the persona that a client manifests when they're with somebody that they know very well is likely to be different than the persona that's manifested when they're talking to a stranger. Then we have the anima. The anima is the feminine part of the male psyche, and the animus is the masculine part of the female psyche. And then we have the shadow, and the shadow contains inappropriate or unacceptable urges, impulses, and desires. So now we'll take a look at attitudes and functions. 2 of the attitudes developed by Jung are introversion and extroversion. So an individual that's introverted is concerned and focused on their own thoughts and ideas, and individuals that are extroverted are more focused on the external world and other people. Then you have the functions. So Carl Jung developed these functions, and you have the rational functions, thinking and feeling, and what we refer to as the non-irrational functions, sensing and intuition. Jung believed that all people have all functions operating, but that these functions would be ranked. And the function that's the most dominant or apparent is referred to as the superior function. The one that is the second most apparent and takes over for the superior function when it's not acting is the auxiliary function. And the function that's lowest ranked is referred to as the inferior function. So as you can see, if you combine introversion and extroversion with thinking, feeling, sensing, and intuition, you come up with 8 personality types. And instruments have been developed to determine what personality type a client has. One of the most common is the myers-briggs type indicator. So if we start with introversion and we first pair it with thinking, we have introverted thinking. And an individual with this personality type is interested in an inner reality and ideas, but it's usually not particularly interested in other people. Moving to introversion combined with feeling, this type is associated with somebody that's reserved, that has sympathy for individuals that are in need, or sympathy for friends, and is generally considered loving. Moving down to introversion and sensing, individuals in this category tend to focus on the experience that situations in their life trigger, rather than the situations themselves. So more the experience and not as much the situation. Oftentimes artists are thought to fall in this category, the introversion sensing category or type. And then the last of the introversion related types is introversion intuition. And a person with this type is considered to be in touch with the unconscious and not particularly concerned about the reality of the present moment, but more concerned with what can be, possibilities for the future. Moving now to the extroversion attitude and pairing it up with functions, we first have extroversion and thinking. A person in this category with this type is considered to be logical and repress feelings and emotions. They typically do not invest a lot of energy in relationships and are interested in information regarding objects that are external to themselves. Moving to extroversion and feeling, this type is associated with individuals who are well adjusted to their environment and have a deep concern about human relationships. Moving to the extroversion sensing type, individuals with this type tend to focus on the situations that lead to experiences as opposed to the experiences themselves. They are interested in factual information and details, and on occasion can be pleasure-seeking. And then the last category for extroversion is the extroversion intuition type, and this type is associated with the adventurer. There is a focus on what the possibilities would be to make changes in the world as opposed to the individual's immediate environment. Now moving on to the stages of development in analytic therapy. For Carl Jung, the stages of development were not a large focus of his therapy. He has just 4 stages of development. The first is childhood, and he felt the goal here was for the child to develop a personal identity to separate from the parents. The next is adolescence, And here the expectation would be an increased comprehension of the persona. The third stage is middle age, and this is where Jung focused a lot of his energy as a therapist. The expectation here in middle age is that an individual would work to establish themselves in their community, in their careers, and in relationships, including family relationships. Jung also believed that in this stage, in middle age, there was the highest probability of the attainment of self-realization, one of the goals of analytic therapy. And the final stage here is old age. And in this stage, individuals work toward understanding their lives and determining meaning in their lives. And also there's a focus on the development of wisdom. So now let's take a look at the cause of symptoms. So in analytic therapy, if unconscious material is not successfully integrated with the conscious mind, that is a potential cause of mental health symptoms, of distress. Another cause could be the disunity among the functions, the thinking, feeling, and sensing and intuition, so the rational and non-rational functions that I discussed earlier. The function that is the least developed, the inferior function, is the one that's most likely to be unconscious, and often the one that would be more likely to be a focus of analytic therapy. So what type of techniques do we see used in analytic therapy? Well, just like in psychoanalytic therapy, dream analysis is a large part of analytic therapy, and largely for the same reason, that through analyzing dreams, it is believed that you can get a look at the material that's stored in the unconscious. For the same reason, free association is also used in analytic therapy. Active imagination is where a client is asked to have a discussion with an imaginary figure, usually a figure that they experienced or perceived in a dream. Jung also included elements like poetry, art, and dance as therapeutic techniques, and the word association test. And what Jung did here was to provide a client a word and then record the first word that came to that client's mind. And he believed that by doing this, he could identify complexes, and then of course move to work on those complexes. Similar to psychoanalytic therapy, catharsis is used in analytic therapy. And catharsis is the release of emotional energy. Jung believed in interpreting transference. And transference is when a client projects onto the counselor feelings that they have toward a significant figure in their life. So Jung did believe it was important to interpret this transference. Jung also liked to explore social needs, and this is similar to Adler, and he wanted to help clients move toward individuation, which is when all the elements of the personality are integrated into a fully realized individual. So taking a look at the goals of analytic therapy, not surprisingly, the main goal is individuation. All the elements of the personality are integrated, and there's a formation of a fully realized self. So this is both a technique and a goal in analytic therapy. So now moving to the last slide. And this is my opinion of how we can use analytic therapy if we're approaching counseling from the point of view of integrating different parts of theories into our own counseling modality, otherwise known as integrative counseling. And these are really just my thoughts on how this can be done from my experience and my knowledge of this particular therapy. Unlike many of the other popular theories of counseling, like existential, Adlerian, reality therapy, it's actually fairly difficult to take components of analytic therapy and regularly use them in an integrated counseling modality, particularly one like mine that's more focused on cognitive and behavioral techniques. There are counselors out there that exclusively use analytic therapy, and there are a few parts that I am able and willing to integrate into my particular counseling style. So first we have the attitudes and the functions. So we have the two attitudes that I discussed here, introversion and extroversion, and then we have the functions, thinking, feeling, sensing, and intuition. I find these attitudes and functions to be useful. I think it's useful to understand where a client may be in terms of the attitudes and functions, and also the results from instruments like the Myers-Briggs type indicator can be helpful when you're trying to gain an understanding of your client's personality characteristics. Another construct in analytic therapy that is useful in integrative counseling would be the idea of the persona. The idea that an individual's personality, at least the one that you can see, the one that they're going to make public, is going to represent only part of the picture. You're only going to see a part of the personality, and it's going to change based on different situations. In a similar way, it's helpful to understand the idea of the shadow, the part of an individual's personality that's pushed into the unconscious. And like in psychoanalytic therapy and a few other therapies, I find the concept of the unconscious mind to be useful. The idea that there's a part of a client's mind that contains material that they might not be aware of, but that may be discoverable using counseling techniques. And then in terms of transference, again, very similar to psychoanalytic therapy, transference is a fundamental concept, and it is an important concept, I believe, to understand. It does happen in the counseling relationship. You can see transference if you are aware what to look for. And I think it is useful to point out when transference is occurring. It's worth noting here, just as is the case with psychoanalytic therapy, that along with transference, there's also countertransference. And countertransference is when the counselor projects their feelings onto the client. And we generally consider this to be negative. And we try to avoid countertransference by having a high degree of self-awareness. So to summarize, analytic therapy has some similarities with psychoanalytic therapy, but it also has some areas where it's quite different. And analytic therapy is actually a very complex therapy, and it's not going to be appropriate for every client or every set of symptoms. There are some areas of analytic therapy, as I mentioned here, that I think are useful to integrate into a counseling modality. But I find that for the vast majority of the items and theoretical components in analytic therapy, the vast majority of these are relatively impractical, I believe, to integrate into counseling modalities. That is, they don't always fit well with our understanding of why people develop symptoms, why those symptoms are maintained, and how people overcome symptoms. And again, I think this is especially true when the primary influence is a cognitive behavioral approach, as is the case for me, but of course is not the case for every counselor. I hope you found this video on the theory of analytic therapy to be useful. As always, if you have any questions or concerns, feel free to contact me, and I'll be happy to assist you.